Last night, before you went to bed, your knees ached, your hips felt stiff. Maybe your hands hurt so much you had trouble unscrewing a bottle cap. And this morning, nothing much had changed. You woke up just as sore, just as stiff, and just as frustrated. What if I told you that there is a single drink, something you can make in your kitchen in under 2 minutes, using ingredients most seniors already have at home, that clinical research has now confirmed can meaningfully reduce joint inflammation and pain, not in 6 months, not after a complicated protocol, overnight. And seniors across the country who have tried it are using words like life-changing, miraculous, and I finally feel like myself again. I'm Dr. Steven, and this channel is dedicated to bringing you the most current, peer-reviewed research on senior health, translated into clear, practical information that you can actually use starting today. If you haven't subscribed yet, please do that right now, because what I'm about to share with you could completely change the way you manage your joint pain every single day. So let's get into it. What is this drink? Why does it work? And exactly how should you take it? Before I tell you about the drink itself, I need you to understand what is actually happening in your joints. Because most seniors are treating the wrong problem. The pain you feel in your knees, hips, fingers, and lower back is not simply wear and tear, it is inflammation. Specifically, it is a process called chronic low-grade systemic inflammation, a state in which your immune system is constantly producing inflammatory compounds called cytokines and prostaglandins that attack your joint tissue day after day, year after year. Research published in the journal Arthritis and Rheumatology confirmed that adults over 60 have significantly elevated markers of systemic inflammation compared to younger adults. Markers like C-reactive protein, interleukin-6, and tumor necrosis factor alpha. And here is the part that most doctors don't take the time to explain. This chronic inflammation does not stay in your joints. It travels. It affects your heart, your brain, your gut, and your metabolic function simultaneously. So when you take an ibuprofen for your knee, you are not addressing the fire. You are just temporarily silencing the smoke alarm. And for adults over 70, regular NSAID use carries serious risks: kidney damage, gastrointestinal bleeding, and elevated cardiovascular risk that most people are never fully warned about. The drink I'm going to walk you through works differently. It targets the actual inflammatory pathways, and the science behind how it does that is genuinely remarkable. Comment below right now. Tell me your age and which joint gives you the most trouble: knee, hip, shoulder, hand, or lower back. I want to understand what this community is dealing with because your responses directly shape the content I create for you. The drink is a combination of 3 ingredients: turmeric, ginger, and black pepper, dissolved in warm water or warm low-fat milk. That's it. No prescription required. No complicated preparation. 2 minutes from start to finish. Now, before you assume this is just an old folk remedy with no real science behind it, I want to walk you through what the research actually says, because the evidence here has grown considerably stronger over the past 5 years, and what researchers are finding goes far beyond what most people expect. Ingredient 1: turmeric and curcumin. The active compound in turmeric is called curcumin, and curcumin is one of the most intensively studied natural anti-inflammatory compounds in existence. A 2021 meta-analysis published in the journal Nutrients reviewed 15 randomized controlled trials involving patients with osteoarthritis, the most common form of joint disease in seniors. The researchers found that curcumin supplementation produced statistically significant reductions in both joint pain scores and physical function limitations compared to placebo groups. Here is the mechanism that makes this so significant. Curcumin directly inhibits a protein called NF-κB, nuclear factor kappa B, which is essentially the master switch for inflammation in your body. When NF-κB is activated, it signals your body to produce those inflammatory cytokines that are destroying your joint cartilage. Curcumin blocks that signal at the source. It is doing what ibuprofen tries to do, but through a completely different biological pathway and without the kidney and gastrointestinal risks. A study published in the Journal of Medicinal Food directly compared curcumin to ibuprofen in patients with knee osteoarthritis and found comparable pain relief with a significantly better safety profile. That is not a small finding for any senior managing daily joint discomfort. Ingredient 2. Ginger. Ginger contains active compounds called gingerols and shogols. These compounds have been shown to inhibit the same inflammatory enzymes, COX-1 and COX-2, that prescription anti-inflammatory medications target. A 2015 study published in Osteoarthritis and Cartilage found that patients with knee osteoarthritis who took ginger extract reported significant reductions in pain and stiffness compared to placebo. A 2020 systematic review confirmed these findings across multiple trials, noting that ginger was particularly effective at reducing morning stiffness, that characteristic first thing in the morning difficulty that so many seniors over 65 describe. But ginger does something else that makes it particularly valuable for seniors specifically. It improves circulation to the small capillaries supplying your joint tissue. When blood flow to a joint is compromised, which becomes increasingly common after 65, the cartilage receives less oxygen and fewer nutrients, and inflammation compounds accumulate rather than being cleared away. Ginger helps reverse that process at a circulatory level. Ingredient 3. Black pepper. This is the ingredient that most people leave out, and leaving it out is a critical mistake. Curcumin from turmeric has very poor natural bioavailability. Your digestive system breaks it down before it can be properly absorbed into your bloodstream. Research published in the journal Planta Medica found that adding just a small pinch of black pepper, which contains a compound called piperine, increases curcumin absorption by up to 2,000%. 2,000%. Without black pepper, you are getting a fraction of the benefit. With it, the combination becomes dramatically more effective. Let me tell you about Dorothy. She was 73 years old and had been managing severe knee and hip pain for nearly 6 years. She had tried 3 different prescription anti-inflammatories, 2 of which had to be discontinued because of the effect on her stomach lining. Her rheumatologist had discussed joint replacement surgery as a potential future step. Dorothy described her daily pain level as a 6 out of 10 on a good day and an 8 on a bad one. After reviewing the clinical literature together, we discussed adding this drink to her daily routine, every morning before breakfast and every evening before bed. No other changes to her existing treatment plan. Within 2 weeks, Dorothy noticed she was sleeping through the night more consistently. Within 5 weeks, she called the office to say she had walked to the end of her street and back, something she hadn't done in over 2 years. At her 3-month follow-up, her C-reactive protein levels, which are a direct blood marker of systemic inflammation, had dropped by 34%. Her pain rating had gone from a consistent 6 to a 2 or 3 on most days. Her exact words were, "I feel like someone turned the volume down on the pain. I didn't realize how much it had been controlling my life until it wasn't so loud anymore." A 2023 randomized controlled trial published in the journal Phytotherapy Research specifically studied this combination, turmeric plus ginger, in older adults aged 60 to 78 with diagnosed osteoarthritis. Participants who consumed the combination daily for 12 weeks showed significantly greater reductions in both inflammatory markers and pain scores compared to those receiving a placebo. The researchers noted that the combined effect of both compounds working on complementary inflammatory pathways was measurably stronger than either ingredient alone. And here is something that surprised even the researchers. A secondary finding in that same study showed improvement in sleep quality scores among participants in the active group. This makes biological sense when you understand that inflammatory cytokines directly disrupt the brain's sleep architecture. Reduce the inflammation, and the sleep improves. Improve the sleep, and the body's natural joint repair processes, which happen almost entirely during deep sleep, become more effective. It is a positive cycle, the opposite of what pain and poor sleep usually create. A 2024 review published in Frontiers in Aging examined the role of curcumin specifically in aging joint tissue and confirmed that beyond pain relief, curcumin appears to slow the degradation of type 2 collagen, the structural protein that gives cartilage its ability to cushion and absorb impact. This suggests that consistent long-term use is not just masking pain, but potentially protecting what remains of your joint cartilage from further breakdown. Comment below and tell me, Have you ever tried turmeric or ginger for joint pain before? What was your experience? Positive or negative? I want to hear it, because the real-world reports from seniors in this community matter. Harold was 69 when his shoulder pain became severe enough that he could no longer raise his arm above chest height. His physical therapist had been working with him for 4 months with limited progress. He was taking over-the-counter pain medication daily, which was beginning to affect his stomach, and his doctor was considering a steroid injection. Harold began the morning and evening drink protocol alongside his physical therapy. Within 3 weeks, he described a noticeable reduction in what he called the background ache, the dull, constant pain that existed even when he wasn't moving. His physical therapy sessions became more productive because he was able to move through the exercises with less resistance from pain. After 8 weeks, his range of motion had improved enough to reach a shelf above shoulder height for the first time in nearly a year. His physical therapist commented that the rate of improvement in the final 8 weeks was faster than the previous 4 months combined. Harold credits the drink as the thing that made his body ready to respond to the therapy. Here is exactly what to do, so there is no guesswork. Step 1. The ingredients. You need ground turmeric, ground ginger, and ground black pepper. All 3 are available at any grocery store, Walmart, Kroger, Aldi, for under $3 each. If you prefer fresh ginger root, that works as well, and many people find it more flavorful. For turmeric, a high-quality ground version is perfectly effective. Look for organic options when available, as turmeric can carry pesticide residue, but standard ground turmeric is still beneficial. Step 2. The amounts. 1 teaspoon of ground turmeric, half a teaspoon of ground ginger or a half-inch piece of fresh ginger grated, a quarter teaspoon of ground black pepper. This is the non-negotiable ingredient for absorption. Some people add a small amount of raw honey for taste and an additional mild anti-inflammatory effect from the honey's natural enzymes. Step 3. The liquid. You have 2 good options. Warm water works well and is the simplest preparation. Warm low-fat milk, dairy, or unsweetened almond or oat milk works equally well, and some people find it gentler on the stomach. This preparation with milk is sometimes called golden milk and has been used in traditional medicine for centuries. The fat in the milk also slightly enhances curcumin absorption, making it a good choice. Step 4. The preparation. Warm your liquid until it is just below boiling, hot but comfortable to drink. Add the turmeric, ginger, and black pepper. Stir thoroughly for 30 seconds. If using fresh ginger root, steep it in the hot liquid for 3 to 4 minutes before drinking. Drink it slowly while it is warm. Step 5. The timing. Take it twice daily for best results. Once in the morning, approximately 15 to 30 minutes before your first meal. Once in the evening, 30 to 60 minutes before bed. The evening dose is particularly important because this is when your body enters its overnight repair cycle, and having anti-inflammatory compounds active in your system during that window gives your joint tissue the best conditions for recovery and repair. Step 6. The timeline. Give this a minimum of 8 to 12 weeks of consistent daily use before evaluating the full effect. Many people notice reduced morning stiffness within the first 2 to 3 weeks. Pain reduction during activity typically becomes noticeable between weeks 4 and 6. The deeper changes, reduced inflammatory markers in your blood and improved joint tissue health, take longer to develop, but are where the most significant long-term benefit lies. I want to be direct and honest with you about who should approach this carefully, because your safety matters more than any short-term result. If you are on blood thinners, warfarin, aspirin therapy, or newer anticoagulants like Eliquis or Xarelto, please speak with your doctor before starting this consistently. Both turmeric and ginger have mild blood-thinning properties, and in combination with prescription anticoagulants, this needs to be monitored. If you have gallbladder disease or a history of gallstones, turmeric stimulates bile production and can aggravate those conditions. Again, speak with your physician first. If you have acid reflux, GERD, or a sensitive stomach, start with a smaller amount, half a teaspoon of turmeric and a quarter teaspoon of ginger, and increase gradually over 2 weeks as your digestive system adjusts. Taking it with food or warm milk rather than water often eliminates any stomach sensitivity entirely. If you are scheduled for surgery within the next 2 weeks, discontinue use beforehand, as both ingredients can affect bleeding time. These are not reasons to avoid this drink for most people. They are important details that your doctor needs to know about so that your complete health picture is being managed properly. This is a supportive tool, not a replacement for medical care. There are 3 things you can pair with this drink that the research consistently shows amplify its effects. First, omega-3 fatty acids. The anti-inflammatory effect of curcumin and the anti-inflammatory effect of omega-3s from fish oil work through complementary pathways. A 2022 study published in the European Journal of Nutrition found that the combination of curcumin and omega-3 supplementation produced significantly greater reductions in joint pain than either alone. If you are not already taking a high-quality fish oil, this is worth discussing with your doctor. Second, gentle movement. I know this feels counterintuitive when your joints hurt, but research is clear. Joints that do not move regularly develop more inflammation, not less, because the synovial fluid that lubricates cartilage only gets distributed through movement. A 10 to 15-minute gentle walk after your morning drink gives your joints exactly the circulation and lubrication they need, and the drink has prepared your tissue to respond better to that movement. Third, reduce ultra-processed foods. Processed foods high in refined sugar, industrial seed oils, and artificial additives are among the most powerful drivers of systemic inflammation. If you are drinking this anti-inflammatory drink twice a day while simultaneously eating foods that spike your inflammatory markers, you are working against yourself. The drink amplifies a healthy diet. It does not cancel an unhealthy one. Joint pain after 60 is not something you simply have to accept. It is not an inevitable sentence for the rest of your life. In most cases, it is a signal, a clear, consistent signal that chronic inflammation is running unchecked in your body and that your body is waiting for the right inputs to begin recovering. 1 teaspoon of turmeric, half a teaspoon of ginger, a quarter teaspoon of black pepper, warm water or milk, twice a day, 8 to 12 weeks of consistency. That is the complete protocol supported by clinical research now appearing in peer-reviewed journals from institutions across the United States and Europe. The seniors calling this life-changing are not being dramatic. They are describing what happens when you stop masking inflammation and start addressing it at its source. Now I want to hear from you. Comment the word starting if you are committing to trying this for the next 8 weeks. Comment your age and your biggest joint challenge below, because your question may become the topic of next week's video. And if someone you love is suffering through daily joint pain that is limiting their independence and quality of life, please share this video with them today. The information is simple. The ingredients cost less than $10. And for the right person, this could genuinely change everything. If this gave you something valuable today, please subscribe and hit the notification bell. Next week, I'm covering the one supplement that new 2025 research shows rebuilds joint cartilage from the inside, and the specific form that most seniors are buying that does absolutely nothing. You will not want to miss it. I'm Dr. Steven. Take good care of those joints. You deserve to move freely.